Understanding MRSA, the Silent Threat, a comprehensive overview. Welcome to the Everything Surgery podcast. Today, we're diving into an important topic in public health, MRSA, or Methicillin-Resistant Staphylococcus aureus. What is MRSA? MRSA is a type of bacteria that's become resistant to common antibiotics like methicillin, penicillin, and amoxicillin. While Staphylococcus aureus is normally found on the skin and in the nose, when it becomes resistant, it can cause severe, sometimes life-threatening infections. Types of MRSA. Let's break down the two main types. MRSA, healthcare-associated MRSA. This strain is commonly found in hospitals, nursing homes, and other healthcare environments. It tends to affect individuals with weakened immune systems, surgical wounds, or those using invasive devices like catheters and IV lines. MRSA, community-associated MRSA. This type affects healthy people outside healthcare facilities, such as those in schools, gyms, and locker rooms. Most often, it causes skin infections like boils and abscesses, but in severe cases, it can lead to pneumonia or bloodstream infections. How does MRSA spread? MRSA primarily spreads through direct contact with an infected person or contaminated surfaces. Open wounds, cuts and abrasions make it easier for the bacteria to enter the body. Crowded environments like prisons, military barracks, and sports teams are particularly vulnerable to outbreaks. Recognizing symptoms. The typical signs of MRSA skin infections include red, swollen, and painful bumps that may ooze pus. In more severe cases, symptoms can escalate to fever, chills, cough, or chest pain, especially if pneumonia develops. In the most critical situations, MRSA can cause sepsis, endocarditis, or even necrotizing fasciitis. Diagnosis. Diagnosing MRSA involves laboratory tests. Samples from wounds, blood, or sputum are cultured to identify the bacteria. Additional testing determines which antibiotics may still be effective. Treatment options for mild skin infections. The initial step is often incision and drainage of abscesses. Antibiotics are prescribed based on the severity. Oral antibiotics, such as clindamycin, doxycycline, or trimethoprim sulfamethoxazole, commonly known as Bactrim. IV antibiotics. For more severe infections, options include vancomycin, daptomycin, or linezolid. In cases of recurrent infections, decolonization measures, like nasal mupirocin creams and antiseptic body washes, e.g., chlorhexidine, may be recommended. Prevention matters. Preventing the spread of MRSA is critical. Key steps include practicing regular hand hygiene with soap or alcohol-based sanitizers, keeping wounds clean and covered, avoiding the sharing of personal items such as towels, razors, or sports equipment, ensuring hospitals follow strict isolation and sterilization protocols. Why is MRSA dangerous? MRSA is a major concern because its resistance to antibiotics leaves fewer treatment options, increasing the risk of serious complications. Its ability to spread quickly can lead to outbreaks both in communities and healthcare settings. For those with compromised immune systems, invasive MRSA infections can be fatal. Emerging threats. Let's not overlook the emerging concerns. There's MRSA, vancomycin-resistant Staphylococcus aureus, a rare but extremely dangerous strain. Additionally, livestock-associated MRSA has been identified in farm animals, posing risks to farmers and meat handlers. Conclusion. In summary, MRSA remains a significant public health challenge due to its antibiotic resistance. Focusing on hygiene, responsible antibiotic use, and early detection is essential to control its spread and reduce complications. Thank you for joining us today. Stay informed, stay safe, and remember, prevention is always better than cure. Until next time, this has been your public health update.